I wanted to take a quick moment today to talk to you about testing that I use in patients with metabolic dysfunction. One of the key drivers of metabolic dysfunction is mitochondrial health, and it's really important to make sure we have all the inputs in the Krebs cycle and we're creating energy inside of the cell so that all of the pieces of the puzzle work properly. So one of the tests that we can actually do is called organic acids testing, and we can look at the byproducts of the Krebs cycle and see at which points we need to put in more nutrients. Maybe there's potential toxins contributing to the organic acid, the cycle actually not moving along. But other times, type 2 diabetes is actually, there's a big contributing factor of gut health and this metabolic endotoxemia. And so this can happen. We have overgrowth of bacteria or yeast. And so in this case, I actually had a patient that presented with what seemed like yeast overgrowth. She had a white tongue. She had constipation. She had some anxiety. So we actually treated her for that. We did some stool testing. We went along with our, glucose lowering plan. We went along with our nutrition plan. But when it was time to figure out and sort of check in, hey, did this work? Why are we still having a little trouble with inflammation and some of your symptoms? It was time to use something like an organic acids test, because we could look at not only that energy cycle, but then we could also pull in and look at some of those markers of the gut. So I just wanted to show you, this is actually a test put together by KBMO Diagnostics. And so here you can see that it tests for fungal markers. I'm just going to move it over on the screen so you can see that she actually did have a couple really high markers here. So that was the arabitol and the furan 2,5 dicarboxylic acid. And so those are markers that potentially are associated with yeast and fungi. So we know that those are high. Her Clostridium metabolites, which I look at a lot in patients that have ADHD, that was actually normal for her. Her other bacterial metabolites looked pretty good. So it looks like most of the overgrowth that she's experiencing is related to yeast at this point, and potentially even maybe some mold. And then other detoxification markers are tested in organic acids as well. So this pyroglutamic acid was elevated in her case, but the rest of her citric acid cycle markers actually look pretty good. Her glycolysis metabolism looked pretty good, and her fatty acid metabolism also looked pretty good. So those are markers that we can look at. And then we also have markers of nutrient deficiency. So the 4-pyridoxic acid, which is a marker of B6, you can see that hers was low. Interestingly, we also have a confirmatory B6 level. So she wasn't deficient per LabCorp standards, but she was what I would consider having insufficient levels of B6 as well. So that was something that was confirmed on here. The rest of her nutrients looked pretty good. So the nice thing is at the end of the report, there's also a couple neurotransmitter markers. So her quinolinic acid was elevated, which we'll talk about in a second, but that is a neurotransmitter marker. So you get a nice picture. This is the Krebs cycle, which if you are a provider that has taken biochemistry or gone through this in college, you might have a little bit of a flashback / PTSD moment when you look at something like this. But the great part about these reports is that it gives you the sort of takeaway at the end here. So I'm trying to make sure this stays on the screen, but the two pieces I talked about at the beginning, the candida and potentially the aspergillus overgrowth, were indicated here. So it lets you know right there that that's what those markers mean. So again, that high arabitol could indicate that candida infection. So maybe we need to dive deeper into figuring out, maybe our treatment wasn't working, or maybe it came back. Maybe it's something like CFAL and we need to work on motility and acid and other things going on in her gut. And then this other marker of detoxification, this is actually important in glutathione recycling. So this could actually be an indicator that she has an overabundance of glutathione usage, and that could be related to the inflammation going on for her. So maybe even in that gut infection. And then we talked about the B6 marker, but then the quinolinic acid is actually a metabolite of tryptophan. So that can be inflammatory, can be neurotoxic. And so this could also be elevated because of that B6 deficiency. So for her, we definitely want to make sure that that B6 deficiency is corrected. And what's going on in the gut could also be impacting B6 absorption too. So there's a lot to think about, but I think for her, it really gave us the direction of, okay, we need to address this nutrient deficiency. She's on metformin. Maybe there's a little bit of impairment in the absorption of B6 because of that. And then also addressing further the gut. So now we're stepping back and saying, okay, we need to go back to that gut plan and figure out why you're having this overgrowth. Is it just candida, or is there something contributing also with a potential aspergillus? So likely it can be corrected even with that gut health as well as the B6. So it gives you some nice takeaways and sort of the next steps, actions when you check out organic acids.